Hello, my name is Diana Cassell. I am the Clinical Director for CAMHS services in the Trust. CAMHS is Child and Adolescent Mental Health Services, and I've had a management role in CAMHS for nearly 10 years. I'm delighted that we now have them all pulled together within the service line that will create much more ability for us to innovate and develop quality across all services. We provide community CAMHS in the 5 boroughs. Each borough has a single point of access which ensures that referrals into the system are dealt with in a timely fashion, getting each family to the right place for the right intervention. We provide a Tier 3 team who sees the children with more significant mental health problems. They provide evidence-based treatments with a good participation focus. We also provide some Tier 2 teams in some of the boroughs, seeing children at a more early help stage. Where we don't provide the Tier 2, we work in collaboration with partner agencies. Within the local contract, we have some specialist teams. There's an eating disorder team, which over the last year has had significant development to include offering group programmes and some daycare. There's a neurodevelopmental disorders team, which focuses on assessments of children who are considered to need assessment for possible autistic spectrum disorder or ADHD. There's a learning disability team which offers full assessment and treatment for children in Wandsworth and second opinion type service for the other boroughs. Our newest team is the emergency care team, who are nurses who see young people who present in the district general hospitals after an overdose or with a mental health crisis. This team now works at weekends and will soon also be working in the evenings. There's a team called the multisystemic therapy team who offer a very specific intervention for children and young people with disruptive and offending type behaviours. This is a very powerful treatment which has extremely good results and is likely to be moving towards a social bond model of provision. Under the national contract, we have 3 wards co-located in the campus. They've all recently been refurbished and have a programme to share resources, run groups and activities across the 3 wards. And there's a school which had an outstanding inspection from Ofsted. The wards are Aquarius, providing acute adolescent general psychiatric care, Wisteria for young people with eating disorders, and Corner House, which is a highly specialist ward for children who are deaf and need a mental health treatment. Community deaf teams also have staff fully trained in British Sign Language and many deaf staff, and they are based in Kent, Cambridge and London, covering the south of England. New developments that we have coming up are working with the CCGs to manage demand for the neuro team. This has been a very much needed and popular service, but unfortunately young people have had to wait unacceptably long periods of time. So that's an important area of work. We're also working with Kingston CCG to fully develop the single point of access there. We will be looking to increase the range of services provided by the Assertive Outreach team. They will be open evenings and weekends, and we'll start providing some additional services to keep more young people out of hospital. And we're looking to develop a psychiatric intensive care unit for very agitated and disturbed children, so we don't have to send them away to other hospitals, which unfortunately have often been in very far distant places. Thank you very much.